If nothing hurts, why do I need x-rays? I hear that question almost every single day. And I'll be honest with you, it's a fair one. If your teeth feel fine, why are we pointing a machine at your head? Here's the thing. The answer reveals something most people don't know about how dental disease actually works. And by the end of this video, I promise you'll think about x-rays completely differently. Let's get into it. Here's the fundamental truth about tooth decay and gum disease. They don't hurt until they're serious. Pain is a late-stage symptom. It's not a warning system, it's a final notice. By the time something hurts, you're usually already looking at a root canal, an extraction, or significant bone loss. Think of an iceberg. What you can feel, what hurts, is maybe 10% of the picture. Decay, bone loss, early infections, they live in the 90% that's underwater. X-rays let us see that 90% before you feel a thing. That's not scare tactics, that's just biology. Now, let's talk about what we can actually see, because this surprises a lot of people. A clinical exam, everything I can see and feel with my eyes and instruments, is limited to what's visible above the gum line. That's actually a small fraction of what's going on in your mouth. X-rays show us cavities between the teeth. This is called interproximal decay, and it's where the majority of cavities hide. You cannot feel them. I cannot see them without an x-ray. They're just quietly growing between your teeth until they're big enough to become a problem. X-rays also show us bone levels, the bone that holds your teeth in place. Losing bone is the hallmark of gum disease, and it happens silently. Until you start losing teeth, we capture it on film. We see infections and abscesses that haven't reached the surface yet, impacted teeth causing damage to neighboring roots, cysts, pathology, root length, and anatomy that is essential in some procedures. None of that shows up on a visual exam. X-rays are not optional for good dentistry. They're how we actually see what's going on. Now here's something patients ask a lot. Why do you use different types of x-rays? Why does it change every visit? Good questions. There are three main types, and each one answers a different clinical question. Bite wings. These are the most common, the small films you bite down on. They show us the crowns on your back teeth, specifically designed to catch cavities between teeth and monitor bone levels. These are the ones we take at most of your routine appointments. Periapicals, or PAs. These show the entire tooth, from the crown all the way down to the root tip. We use these when we're evaluating a specific tooth, checking for infection, a root fracture, or bone loss around one particular area. And then there's the panoramic, or pano. This is the x-ray taken from outside your head where the machine rotates around you. It gives a full mouth view, all of your teeth, both jaws, your sinuses, your jaw joints, and the surrounding bone all in one single image. It's a big picture, wide-angle panoramic view. Excellent for evaluating wisdom teeth, spotting pathology in areas bite wings can't reach, and getting a comprehensive baseline on a new patient. So when you see us switching up which x-ray we're taking, it's not random. We're choosing a tool that answers the specific questions we're asking about your teeth. I know the word radiation sounds alarming, so let's talk actual numbers. A full set of dental x-rays, a complete mouth series, exposes you to roughly the same amount of radiation as a 1 or 2 hour airplane flight, or 1 day of normal background radiation that you're already being exposed to every single day you're living on this planet. We use digital x-rays in our office, and digital technology has reduced radiation exposure by up to 80% compared to old school film x-rays. The dose is genuinely minimal. We wouldn't use x-rays if the benefit didn't vastly outweigh the risk, because it does. Here's something worth knowing about kids and x-rays. Baby teeth have much thinner enamel than adult teeth, which means when decay starts, it can move quickly. If I suspect something is progressing faster than usual, I may recommend x-rays sooner than a standard recall schedule. Not because it's routine, but because catching it early makes a real difference. We're also monitoring jaw development, how permanent teeth are erupting, and whether there's crowding we need to get ahead of. Every child is different, and the timing is always a clinical decision. For adults, frequency isn't one size fits all either. It's based on your individual risk factors. Cavity history, gum disease, dry mouth, medications you're taking, diet. Some patients are low risk and we can space them out. Others need them more often. That's a decision we make together based on what's actually going on in your mouth. One more question I get regularly is, I'm pregnant. Is it safe to have x-rays taken? The short answer is that dental x-rays are considered safe during pregnancy. We use a lead apron and the dose is very low. That said, my personal approach is conservative. In most cases, I'll defer routine x-rays during pregnancy and wait. If there's an emergency, pain, or something that genuinely needs to be evaluated though, that's a different conversation, and it's worth the x-ray. Every situation is different, and we'll always talk it through. But if you're pregnant and due for a routine cleaning, don't worry. We'll take good care of you and use good judgment on what you actually need. Last thing, let's talk about what x-rays actually cost, because I think patients misread this. Catching a cavity on x-ray costs you a filling. Missing it costs you a root canal, crown, maybe an implant. X-rays don't add to your dental bill. They're the reason your dental bill doesn't become a financial emergency. So the next time you hear, we're going to take some x-rays today, you'll know exactly what we're looking for and why it matters. It's not upselling. It's not routine box checking. It's how we see the full picture of your health that nothing else can show us. If you've got questions about your own x-rays, give us a call at 630-963-6750 or visit jacksonfamilydentistry.us. And if this video helped you, hit that subscribe button. New content all the time. I'll see you in the next one. Bye now.